Okay.
Bismillahirrahmanirrahim. I hope you are in good health and taking good care of yourself and the people around you. Yesterday we studied about with the introduction of the heart. But before we proceed to the action potential in the heart and the initiation and the propagation of cardiac impulse in the cardiac muscle, first of all, I will want to give an overview of the autonomic nervous system. The autonomic nervous system, as you all know from your previous knowledge, that is a portion of the nervous system that controls the most visceral part of the functions of the body. So, like the central nervous system is there's central nervous system. There's an autonomic nervous system which usually controls the functions of the viscera. So, this control is involuntary control of the organs. Now, the autonomic nervous system is divided into sympathetic nervous system and the parasympathetic nervous system. The autonomic nervous system, which usually control the visceral function of the body, is divided into two divisions: sympathetic nervous system and the parasympathetic nervous system. Now, in this lecture, we have the 5 learning objective. We have to learn the definition: what is actually the autonomic nervous system, what are components and the anatomy, what neurotransmitters are released at the end of the nerve present in the autonomic nervous system, and though the neurotransmitters act on which type of receptors, and then when they act on the receptor, what are the actions on those viscera. So basically, the involuntary control of the body is controlled by the autonomic nervous system through sympathetic and parasympathetic nervous system. So usually the functions of the autonomic nervous system is divided into 3 parts. It acts on the smooth muscle. All the viscera which have smooth muscles are supplied by the both sympathetic nerve fibers and the parasympathetic nerve fibers. And the second is the other glands, and third is the heart. So these are the all 3 areas which are involuntary control. Unintentionally they are controlled by other autonomic muscle. Otherwise, all the skeletal muscle is controlled by just like the skeletal muscle are controlled with the central nervous system. They are voluntary control, the way you can voluntarily move our hands, our different parts of the body. But the viscera like the stomach, the bladder, the GI, all the portion of the GIT, the ureter, and the heart and the glands, they keep on working without the voluntary control of our body. So what actually the difference between the functions of the sympathetic and the parasympathetic nervous system? The sympathetic nervous system has a control in fight and flight conditions. For example, during exercise, during excitement, in emergency condition and embarrassment. The sympathetic nervous system starts within few seconds, just like when you are appearing in the viva, your heart starts beating at a faster rate. Within 2 to 3 seconds, the heart rate increases. So in any flight and fight flight conditions, the sympathetic nervous system, it dominates, and it increases it has different functions. So what are the 3 conditions in which the sympathetic nervous system activates? And during exercise, any fight and flight conditions like exercise, excitement, emergency, and embarrassment. Whereas the parasympathetic nervous system is just the opposite when you are in the resting state. So it is the function is rest and digest. It means it has a role in digestion, in defecation, in diuresis, in all these conditions when you are not in an anxious state. When you're in a relaxed state, the function of the parasympathetic system predominates. So these are the 2 basic difference. The sympathetic, when you are in the fight and flight reaction, and the sympathetic is the function is rest and digest. Now, the sympathetic and the parasympathetic nervous system, they function in opposition to each other. They have the control on visceral function. They function very rapidly and intensely within few seconds. I told you that they act within few seconds. Within 2 or 3 seconds, the sympathetic and parasympathetic nervous system will control the function of the viscera. So they are antagonists to each other. The sympathetic and the parasympathetic nervous system, they are antagonist system. If the sympathetic nervous system increases, for example, it increases the heart rate, parasympathetic will decrease the heart rate. And in the GIT of the parasympathetic nervous system, it decreases the GIT motility, the parasympathetic system will increase the GIT motility. So they are always antagonists to each other. They function in opposition to each other. Now, the autonomic nervous system, in the nerves of the autonomic system, is in itself controlled by the different areas of the spinal cord, brainstem, hypothalamus, cerebral cortex, and the limbic system, which are present in the brain and the spinal cord. It has different centers because these centers, for example, the hypothalamus and the cerebral cortex, they receive different input from different parts of the body. For example, in emotional state, the hypothalamus has a role in emotional conditions, the cerebral cortex, the behavior, the anger, all these input which are coming from different parts of the body have control on these sympathetic and the parasympathetic nervous system. These centers, the spinal cord, the brainstem, the hypothalamus, cerebral cortex, and the limbic cortex, send signals to lower center, which then influence the autonomic nervous system. Just like in the case of controlling the blood pressure, the vasomotor center is influenced by all these centers. So any condition which any anger, the rage, any emotional condition that which tends to increase the blood pressure, which in this way it controls the nerves of the autonomic nervous system. Now, from where does the sympathetic nervous system, sympathetic and the parasympathetic nerves originate? What is the origin of the sympathetic outflow and the parasympathetic nerves? Now, and which nerves carry these fibers? Now, you know that the vertebral column in the spinal cord is surrounded by the vertebral column, and there are different vertebrae starting from the cervical, which is present in the neck. Then we have the thoracic, which is present in the thorax, which is passing through the thorax. Then the lumbar, the sacral. These are the different vertebrae. So the origin of from starting the input coming from the higher sentence, and these fibers originating from this part of the spinal cord. So those part of the spinal cord, the vertebral column, from the thoracic one to L2 of the lumbar 2 of the vertebra. They are originating, these fibers are originating from these part of the spinal cord. The thoracic one, so this is the part of the vertebral column which is present in the neck is called cervical. The vertebra which is present in the thorax is called thoracic nerves, and which are originating from the lumbar are called the lumbar nerves, and the sacral which are present in the pelvis. So the origin of the sympathetic nerves are from thoracic T1, thoracic 1, and till T2, and then lumbar 1 and lumbar 2. This is the origin of the outflow, sympathetic outflow. Now, this spinal cord is so this is the origin of the I will later tell you shortly what is actually the sympathetic nervous system. I will just tell you the outflow. Then comes the parasympathetic outflow, in which nerves they are parasympathetic outflow is craniosacral, means they are either these parasympathetic nerves are present in certain cranial nerves. Cranial nerves are those nerves which are originating from the brain. So there are 12 cranial nerves, and out of those cranial nerves, only the 3rd, 7th, and the 9th and 10th cranial nerves have parasympathetic fibers. So I'm again repeating, there are 12 cranial nerves. Cranial nerves are those nerves which are originating from the brain and which are supplying different parts of the body, like just the eye, the viscera, and the GIT viscera. So only the 3rd, 7th, 9th, and the 10th cranial nerve having parasympathetic fibers. 3rd nerve is oculomotor nerve, which supplies mostly the muscles of the muscles of the eye, and constriction and dilation of the pupil. And 7th nerve is the facial nerve, which controls the muscles of the muscles of the face. And then the 9th nerve, the glossopharyngeal nerve, which supplies the thorax. And then is the 10th cranial nerve, which is called the vagus nerve, which supplies the heart and all the viscera starting from the esophagus till the anus. So these are the four cranial nerves: the oculomotor nerve, the facial nerve, the ninth is the glossopharyngeal, and the 10th vagus nerve. These cranial nerves carrying parasympathetic fibers. Then, since its origin is craniosacral, so sacral means the vertebrae which are present in the sacrum part of the sacral vertebrae, they are originating from the rest of the fibers. Parasympathetic fibers are originating from these sacral vertebrae, and they are supplying to different the viscera of the body. So this is the origin of the sympathetic and the parasympathetic nerve. The sympathetic outflow is the from T thoracic 1 till thoracic 12, and then L1 and L2. So T1 to L2 is the sympathetic outflow from these areas of the vertebra, the sympathetic nerves originating. And the parasympathetic outflow is craniosacral, means the way four cranial nerves which carry parasympathetic fibers, third, 7, 9, and the 10 cranial nerves. And the sacral is from the sacral vertebra. From the rest of the parasympathetic fibers are originating from these vertebrae and supplying different viscera. So next is the components of these autonomic nervous system. That means the sympathetic fibers, the which are originating when and finally it reaches the originating from the vertebral column or the cranial nerves, and finally they end up in any viscera. So during this pathway they have three components: the preganglionic fibers, the ganglion, and the postganglionic fibers. The ganglion is basically a relay station. The preganglionic fibers are those fibers which are originating in the sympathetic nerve, in the case of sympathetic nervous system, from the vertebral column, and in the case of parasympathetic nerves originating from the brain. And then they relay in certain ganglion, which is a relay station. And the fibers which are leaving the ganglions are called the postganglionic fibers. So the fibers, nerve fibers before the ganglion are called preganglionic fibers, and the fibers after the ganglion are called the postganglionic fibers. So this is preganglionic. So these are the showing the preganglionic. This is the ganglion. The fibers before the ganglion is called preganglionic fiber. This is the brain. This is the spinal cord. From here, if it is sympathetic nervous system, the fibers which originating from the spinal cord till the ganglion are called preganglionic fibers. Then they relay into the ganglion, and the fibers after the ganglion is called the postganglionic fibers, and then it terminates on any viscera or after terminating into the receptor. So this is the structure of the autonomic nervous system. So first of all, we will discuss about the sympathetic nerve, the structure of the sympathetic nervous system. So this is the spinal cord. This is the spinal cord. This is thoracic 1 and this is L2. So this is the extent of the sympathetic outflow. Now the preganglionic fibers originating from these vertebrae are called the preganglionic fibers. Now we have this ganglionic chain, paraganglionic chain, which is running along the spinal cord, and this is called the paraganglionic. These are why it is called paraganglionic, because it is running along the spinal cord. So I've told you that the fibers before the ganglion, this is the preganglionic fibers. Now the fibers, when they leave the ganglion and reach the viscera, that area of the nerve is called the postganglionic fibers. Now, beside this paraganglionic chain, there are certain other ganglions are also present near the viscera. For example, there is a celiac ganglion, there is a hypogastric ganglion, other than this paraganglionic chain. So these fibers, postganglionic fibers, they terminate into either into the eye and causes dilation of the pupil. I'm talking about the sympathetic nervous system. So in the heart, they cause increases the heart rate. In the bronchi, in the lungs, it causes constriction of the bronchioles. In the GIT on the stomach, it decreases the motility of the intestine or the stomach. In the they have also different function, the ureter. Then it also innervates the bladder. So this is how it controls the different viscera of the body. And other than this, they also have supply the blood vessels, and they may cause the vasoconstriction of the blood vessels, and innervation may cause vasodilation. Other than this, they also may supply the sweat glands. Okay, they also but the action on the cellular is a little bit different than the rest of the viscera. So this is the structure of the sympathetic nervous system. The origin from the thoracic 1 to L2. It is there's a paraganglionic chain which is running along the spinal cord. The fibers before the ganglion are called the preganglionic fibers, and after the ganglion they are called the postganglionic fibers, and they terminate on different organs of the body. So the fibers which are originating from thoracic 1 generally passes up to the sympathetic chain to terminate in the head. So they are supplying the head, for example, in the eye. From the T2, they terminate into the neck. So they are the fibers which are originated from the thoracic 2, usually innervate the area of the neck. From T3 to T6, they innervate the area in the thorax. That's why, for example, the lungs, the heart. Then the fibers which are originating from thoracic 7 to thoracic 11, they are innervating the viscera which are present in the abdomen, and the nerve fibers which are originating from thoracic 12 to L2 are supplying the glands or the anything which is present into the legs. So this is how the division of the nerve fibers in the whole body. Now talking about the parasympathetic nervous system. I've told you its origin is craniosacral. Cranial means I told you that 4 cranial nerves is carrying the parasympathetic fibers. They were called cranial nerve because they originated from the brain. Third, seventh, ninth, and the 10th cranial nerve. The third nerve is supplying the eye. Then the seventh cranial nerve, the face, and the ninth is supplying the thorax. Sorry, the larynx, that way in neck region, and the vagus nerve is supplying the rest of the whole viscera. It is a large nerve. So in this case, it is a bit different from the sympathetic nervous system, because in this case, the preganglionic fibers are very long. Because here in the case of parasympathetic nerve, the ganglions are usually present usually on the viscera. The ganglions are present on the viscera. So the preganglionic fibers from the origin runs a long distance and they terminate on the ganglion, which are usually present on the viscera. And the small porous ganglionic fibers from the ganglion to the ending up in the same viscera. So there is a small postganglionic fiber. So long preganglionic fibers, because the ganglions are usually present on the viscera, and the short postganglionic fibers. Now these are the vagus nerve, which is supplying the rest of the usually the GIT and the heart and all this. Then we have the sacral origin from the S1, S2, usually from S2, 3 and 4, which is also supplying the bladder and the usually control the defecation and the micturition reflex. So this is the craniosacral origin. From the cranial nerve, 4 cranial nerve, and the 4 sacral nerve, which is originating from the sacral vertebra. So this is the origin of the parasympathetic nerve. Now, in the case of parasympathetic nerve, 75% of the parasympathetic fibers are present in the vagus nerve. 75% of the parasympathetic fibers are present in the vagus nerve, which supplies not only to the heart, but the lungs, the esophagus, the stomach, the entire small intestine, the proximal part of the large intestine, liver, gallbladder, pancreas, and upper 1/3 of the ureter. This is a very big nerve which is supplying the large part of the visceras. Now, so this is all about the nerves. Now they at the end, the nerve endings, certain both in the case of sympathetic nervous system and the parasympathetic nervous system, when these fibers, the sympathetic and the parasympathetic nervous system, when they reach the visceras, or the areas on which they are, the way they is visceras or the organs or the heart, when they reach the visceras, they secrete certain neurotransmitters. Neurotransmitters are the chemicals which are released by the chemicals. So they are called the neurotransmitter. The chemicals which are released by the nerve endings are called neurotransmitter. So the neurotransmitter which is released at the nerve endings of sympathetic and the parasympathetic nervous systems are different. The nerve fibers secreting those nerve fibers which secrete acetylcholine at the nerve endings are called the cholinergic nerve fiber. Cholinergic nerve fibers. So the fibers are called cholinergic and the neurotransmitter is acetylcholine. Now those nerve fibers which secrete adrenaline at the ends are called adrenergic nerve fibers. So we have two types of fibers and two types of neurotransmitters. Those nerve fibers which secrete at the end acetylcholine are called cholinergic nerve fibers, whereas those fibers which secrete adrenaline at the nerve endings or non-adrenaline at the nerve endings are called adrenergic nerve fibers. Now, so we have four types of fibers: preganglionic sympathetic fibers, postganglionic sympathetic fibers, preganglionic parasympathetic fibers, and the postganglionic parasympathetic fibers. And preganglionic sympathetic and parasympathetic, and postganglionic sympathetic and parasympathetic fibers. Now, all the preganglionic fibers in both the sympathetic and parasympathetic are cholinergic. And it means that all the preganglionic fibers, both in the case of sympathetic and the parasympathetic nervous system, at the level of ganglion, they secrete acetylcholine. So they both the cases they are cholinergic nerve fibers. Whereas most of the postganglionic sympathetic fibers are adrenergic, except the sweat gland and the few blood vessels which are cholinergic. So postganglionic sympathetic fibers, except sweat glands and few blood vessels, they are adrenergic. And the postganglionic parasympathetic nerve endings are cholinergic. So out of four, three types of fibers are cholinergic and only one is adrenergic: preganglionic sympathetic, and postganglionic parasympathetic nerve fibers are cholinergic, whereas postganglionic sympathetic fibers are only adrenergic. इसमें भी थोड़ा सा exception है, that the sweat glands and blood vessels are cholinergic. I hope you have you understand what I'm telling you. So out of four, preganglionic sympathetic, preganglionic parasympathetic, postganglionic sympathetic, and postganglionic parasympathetic, three are cholinergic. Only postganglionic sympathetic fibers are adrenergic. It means that are secreting non-adrenaline. And remember, sweat glands and blood vessels, there are few blood vessels which are exception. They are again it's cholinergic. Now that was about the neurotransmitter. Now when the neurotransmitters are released at the end of the nerve fibers, they have to act on certain receptors which are present on the viscera. So there are different types of receptors which are present on the viscera, and the neurotransmitter, the action is different when they act on different receptors. So before the neurotransmitter can stimulate an effector organ, it must first bind with the specific receptors on the effector cells. To the other end of the receptor protein causes a change in the cell membrane permeability and activation or inactivating an enzyme attached. Now there are two types of receptor: adrenergic and cholinergic receptors. Adrenergic receptors are two types. Either adrenergic receptors कौन से होंगे, on which adrenaline is adrenergic nerve fiber have release adrenaline, not adrenaline. So for the adrenaline, there are two types of receptors: either alpha receptors or the beta receptor. I again repeat, adrenergic receptors are of two types: alpha and the beta. Alpha receptors are further subdivided into alpha 1 and alpha 2. Beta receptors are further subdivided into beta 1, beta 2, and beta 3 receptors. Now, norepinephrine mainly excites the alpha receptors. First of all, before proceeding, I just want to tell you that norepinephrine is a neurotransmitter which is released at the end of adrenergic nerve fibers, whereas epinephrine is a hormone which is released from adrenal medulla but has an action similar to the non-epinephrine. So they are having action almost same, but non-epinephrine are usually called a neurotransmitter because it is released by the nerve endings of adrenergic fibers, whereas epinephrine is released by adrenal medulla gland and it is a hormone, but its action is usually same as that of epinephrine. So norepinephrine mainly excites the alpha receptors and to a lesser extent the beta receptors, whereas epinephrine excites, which is a hormone released by adrenal medulla, excites both the receptors equally. So the effect on an organ depends upon relative number of the receptors. Now heart usually have beta receptors. Heart have always a beta receptors. A beta receptors पे कौन act कर रहा था? The usually more both adrenaline epinephrine or epinephrine acts. Beta receptors called cardio acceleration. When adrenaline acts on beta 1 receptor, it called cardio acceleration, and when epinephrine or epinephrine acts. And blood vessels have usually alpha 1 and beta 2 receptors. Norepinephrine causes vasoconstriction when axon alpha 1 receptors, but causes vasodilation when axon beta 2 receptors. I again repeat, heart muscle has beta 1 receptors. So when adrenaline or adrenaline or epinephrine, norepinephrine act on beta 1 receptor, it called cardio acceleration. Whereas the alpha 1 receptors are present in the blood vessels, and when norepinephrine causes vasoconstriction when it acts on alpha 1 receptors, but it causes vasodilation when it acts on beta 2 receptors. Now to talk about acetylcholine receptors. There are two types of acetylcholine receptors, nicotinic receptors and the muscarinic receptors. Nicotinic receptors are present on the endings of the preganglionic neurons of both the sympathetic and parasympathetic nerve. So it means they are present on the ganglions where the preganglionic fibers they terminate. So nicotinic receptors are present on the act on the endings of the preganglionic neurons of both the sympathetic and parasympathetic nerve, whereas the muscarinic receptors are present in the endings of postganglionic or cholinergic nerve endings. So now the functions of the autonomic, difference of the functions of the autonomic nervous system. First of all, what does sympathetic nervous system do? It on the heart, by acting on the beta 1 receptor, it increases the heart rate, it increases the force of contraction, and increases the contractility. Whereas on the blood receptors, if it acts on the alpha 1 receptor, it causes vasoconstriction, and if it acts on the beta 2, it causes vasodilation. Sympathetic nerve fibers, the epinephrine and norepinephrine on the lungs, they call bronchoconstriction. When you must have known that the patients of the asthma, they are usually given, they are suffering from, they are having so they are called bronchodilation. So they, when the asthmatic patient, they are suffering from bronchoconstriction, they are giving sympathomimetic drugs, because sympathomimetic drugs are those drugs which have action similar to the sympathetic epinephrine and non-epinephrines, like Ventolin. The Ventolin, which is sympathomimetic drug, causes bronchodilation. So the effect of sympathetic nervous system or the epinephrine or norepinephrine on the lungs is bronchodilation. They dilate the bronchioles. The Ventolin drug is a sympathomimetic drug that causes vasodilation and is given in the case of asthma. In the GIT, sympathetic nervous system, it decreases the motility of the GIT. It decreases the motility of the stomach, the small intestine, the large intestine. It causes contraction of the sphincter. It causes decreased secretion of the enzymes and the of the secretion of the different of the GIT. So decreased motility, sphincter contraction, so that the food content cannot be propelled forward, and decreases the motility. You must have noticed the experience whenever you are in fear or you are anxious, GIT motility, it decreases. Whereas the parasympathetic nerve on the heart, it decreases the heart rate. It is a relaxing, I told you, in rest and digest, it decreases the heart rate and it decreases the force of contraction of the heart. In the blood vessels, it has no effect. In the lungs, it causes bronchoconstriction. In the GIT, it increases the motility of the GIT, the stomach motility, the intestine, large intestine motility. It causes relaxation of the sphincter, because unless and until the sphincters between the two organs, just like the sphincter which is present between the stomach and the small intestine, unless it is relaxed, the food content cannot be propelled from the stomach into the small intestine. So it causes a relaxation of the sphincter. Moreover, it causes increased secretion of the different hormones or the different the secretion produced by the GIT. So this is the basic difference. Moreover, on the in the eye, the sympathetic nervous system causes pupil dilation, where a parasympathetic nerve, it causes pupillary constriction. So there are a few other differences. The point of telling you the autonomic nervous system, so that you can understand the control of the heart. Although heart is independent and can generate its own impulse, but the alteration of the in the heart activity can be done by through sympathetic and the parasympathetic nerve. So I hope you understand the lecture, and tomorrow inshallah we will discuss the action potential which is taking place in the myocardium and in the pacemaker of the heart.